Hi guys, it's Dr. Ozzy here. Welcome back to my channel. Today we're talking all about hair loss. If you're experiencing hair loss, it's so important to see your doctor. Particularly you want to see a dermatologist. A dermatologist is a medical doctor that specializes in the skin, hair, and nails. It can be due to an immune response. So sometimes our bodies have these white blood cells. They're the ones that defend us against infections and cancers. Sometimes these white blood cells, our own white blood cells, can start to attack the hair follicle. And the hair follicles are there, they just cannot grow. That's a special type of hair loss called alopecia areata. Now, I'm not really going to tell you too much about that, but if you experience that, you will notice patches of hair loss throughout your scalp, and you need to see your dermatologist because what they can do is inject it with different medications that can get these white blood cells away from your follicles so your hair follicles can grow. There are many other reasons for hair loss, which is why it's so important to see a dermatologist. Today, we're going to focus on female pattern hair loss, which is the equivalent of male pattern baldness or androgenetic alopecia. Now, unlike males, females actually never go bald. They'll go really thin and they'll keep their frontal hairline, but they won't go bald like we see in men. So what can we do to slow down hair loss, reverse it, treat it, and get the hair stimulated again? Well, one thing is a over-the-counter solution called Rogaine, or minoxidil is the generic. You can start that twice a day. You will notice a little bit of shedding at the beginning, maybe a couple weeks, because it will transition the hairs that in the resting cycle into the growing cycle. Another great over-the-counter treatment would be a vitamin called biotin. Biotin is important for hair, nails, and skin, and it particularly supports hair growth. So that's something else that you can start on your own. Now, I would suggest that you see a board-certified dermatologist who is a medical doctor specializing in hair, skin, and nails, and they can give you prescriptions. We keep a prescription in our office called Hair Restore RX, which is going to be stronger than the Rogaine over the counter. There are also different pills and medications that you can take. Now, remember, these hair follicles in this type of hair loss are programmed to shrink with time and eventually go away. So you want to start treatment early. The earlier the better, because you can save a lot of those hair follicles and keep them in the growing cycle longer. Once I start these hair prescription solutions or the Rogaine, do I have to keep doing it? And the answer is yes, because these solutions and ingredients are what is keeping your hairs going. So otherwise, without the stimulation, your hair would go back to what it would have done had you never started these treatments. And you've probably noticed with each decade of life, your hair gets thinner and thinner and thinner. So start treatment early and never stop. I usually tell my patients, put it next to your toothbrush, and you know you're gonna brush your teeth twice a day. And so use the solution when you do that, makes it easy to do. And if your hair gets greasy from the solution, a little trick is using dry shampoo. I tend to apply my solution at night and wash it off in the morning. So what can we do at a doctor's office? These are things that you can do on your own, but at a doctor's office, a very popular treatment in my practice is doing PRP for hair stimulation. And PRP, you may have heard of this before, is platelet-rich plasma. The plasma has platelets in it that are rich in growth factors. And we take those growth factors and we inject them into your skin of the scalp. That gets into the hair follicles and stimulates them to nurture them and get them to grow and stay in the growing cycle longer. So you see, we take your blood and we spin it down. And when we spin it down in these vials, it will separate the blood into red blood cells, plasma, and a little sliver of white blood cells. The plasma is where it's at. It has the platelets with all the nutrients and growth factors, and we take that and we use this device called a mesorim. A mesorim has all these little tiny needles, and we take the PRP solution and we inject it into the scalp. The beauty of the mesorim is that you will only feel one prick, but you have all these needles going into different parts of the scalp. We can also do microneedling with PRP. Not only can we inject the PRP, but we can do a procedure called microneedling. And here I have the collagen pin, and with this device, you have little tiny needles that go in and out of the scalp multiple times. And what that does is it stimulates your skin to release growth factors and nutrients that again will nourish and revitalize the hair follicles. Also, by forming all these channels now, we can use different medications that stimulate hair follicles and apply it to the scalp. They go down these channels, get to the hair follicles, and revitalize them. So that's another popular treatment for hair stimulation. So in terms of the PRP for hair growth and the microneedling, a common question is, how many sessions do I need? So we really should be doing one session every 4 weeks for a total of 4 sessions. You need multiple treatments to see results. The first 3 sessions I would do every 4 weeks. Then I would do a final session 3 months after the last session. Now guys, remember, you have to be patient. It's gonna take about 6 months to a year to really see the effects. That's when you're really going to see the hair stimulation, and it takes time for the follicles to grow. They have to cycle through the different hair growth cycles, and by the time they get, woken up and start growing, it's gonna take some time, so be patient. Other things would be low-level light. Low-level light has been shown to stimulate and revitalize hair follicles. So that's something that you can get with a cap. There's also brushes that you can use to get the light therapy onto your scalp to stimulate the follicles. Those are some tips and tricks for hair growth. Now remember, make sure you see a board-certified dermatologist or a medical doctor, because hair loss can have a lot of different reasons, and we have a lot of different ways to treat it. Thanks for joining me today. Now, if you enjoyed this episode, make sure to rate, review, and subscribe, and leave me a comment. Let me know what you want me to talk about next. Thanks for tuning in.